these two, what are these?
Kidney.
The kidneys. And of course you can see one that's been cut along a sagittal section, and you can see that cavity inside the kidney. And this is where urine collects, so what do we call that? That's called the renal pelvis. You can also see coming out of the kidney these tubes that are going down to this structure, which is the urinary bladder, and of course the tubes are called ureters. They also come up on the underside or the inferior side of the urinary bladder. You can see the openings, and then of course you can also see the opening to the outside, which we would call the urethra. The urethra. So don't get urethra and ureters confused. And then right there, the opening of the urethra and the two openings of the ureters form a little triangular region that is referred to as the trigone. Trigone. Okay? Also on this, you can see these two structures sitting on top of the kidney.
Adrenal glands.
Those are the adrenal glands. And then, of course, you can see, what is this red?
Artery.
That would be the abdominal aorta.
Oh, okay.
And then it splits into the common iliacs, which then one branch going internal, right, into the pelvic cavity region. This would be called the internal iliac, and the one that's going outside and eventually down into the leg is called the external. And then right there, which is really part of the vessel that's in the leg now, is called the femoral or the femoral artery. So you can see a lot of the arteries in the lower extremity. This one?
Vena cava?
This was the vena cava, and specifically the inferior vena cava, right? You can also see the renal veins that drain blood out of the kidneys and into that vena cava. You all right with that?
Yeah.
Okay. Now, if we look at more detail on the kidney, and on this model specifically, you can see a nice lighter outer layer, which is called the cortex, a darker layer that lies deep to that cortex called the medulla, and in the medulla you have these pyramid or conical shaped masses of tissue, which we call the renal pyramids, the pyramids. Between the renal pyramids are narrower little layers of tissue that are part of what is called a renal column.
Renal column.
Renal column. And it is through those regions that the blood vessels supplying blood to the kidneys pass. Speaking of blood vessels, this depression right here, what is it called?
The hilum.
Hilum. And then you have the artery coming in? It's actually a branch off of the abdominal aorta, supplying blood to the entire kidney.
Acute?
No, this is the renal artery.
Renal artery.
Renal artery, which then at the hilus branches into 5 major branches called
the segmental.
Segmental arteries, which then go up through the columns as, what are they called? Interlobar.
I was about to say lobar.
Interlobar arteries, and then as they branch and curve around at the base of the pyramids, that is between the cortex and the medulla, we call these arcuate. Then branches off of the arcuate radiate outward into the cortex, so we call these cortical radiate arteries. And then, since this is a section out of the cortex and the medulla, you're looking at one renal pyramid, you can actually see here's the cortical radiate, and then the little branches of arteries that come off are called afferent arterioles. Which then give rise to the little glomeruli that is part of a nephron. So the glomerulus as a little capillary network is the first part of a nephron. Then you have, shown in white, a tubular structure that is called the renal tubule, and the very first part of it is a capsule that encases the glomerulus, which is called Bowman's capsule, or simply the glomerular capsule. Okay? Extending off
Proximal.
is the proximal convoluted
Convoluted.
tubule, which then eventually dives down into the
Loop of Henle.
medulla, and it's called the loop of Henle, but this first part is the descending limb of the loop of Henle. This is often called the hairpin loop because it reverses itself, and then it
Ascending.
passes back up as the ascending limb of the loop of Henle.
The
Then it-
distal convoluted.
then it becomes the distal convoluted tubule, which then the nephron ends right at that point, but it does connect to another duct called the collecting duct or the collecting tubule, which again passes right back down through the entire length of the renal pyramid, and at the papilla it opens up, and this is where urine drains out into what is called a minor calyx, which is part of the renal pelvis. Got that?
And there's the minor what layers did you say?
No, the minor calyx, which is this little narrow passageway. Typically, minor calyx drains urine from one renal pyramid.
Roger.
And then from multiple ones, you get a wider area, and that's called a major calyx.
Major calyx, that's
Yeah.
what I was looking at.
Okay.
Minor and major.
Right. And so over here, you can see then just an enlarged view of the glomerulus and Bowman's capsule, which encases the glomerulus, and you can see a little part of the proximal convoluted tubule, and you can also see a part of the distal convoluted tubule here, okay? Afferent arteriole, efferent arteriole, glomerulus, Bowman's capsule, proximal convoluted tubule.
All right.
Is that all right?
Yeah.
And then on this model,